So nicotine replacement therapy has been around for quite some time, and there's actually a lot of studies and extremely good evidence in terms of the use of NRT to help people stop smoking. This is actually from a guideline. It's quite an oldish guideline. It's sort of 10, 15 years old. But this is something called the Fagerstrom test for nicotine dependence. And that's quite nice if you want to try and get an idea of exactly what level of dependence they have. That might give you an idea of how heavy duty are you going to have to go in with your nicotine. So for example, it's got questions like, how soon after you wake up do you need to smoke? How difficult is it to not smoke when you're in a place where it's forbidden? Like, do you have to leave the movies to go and have a cigarette, or you can't do long haul flights? Which cigarettes would you hate most to give up, the first in the morning or any others? How many cigarettes, obviously, do you smoke in the day? Do you smoke more frequently in the beginning of the day? So it's all these sort of questions, gives you an idea of how much patients go into withdrawal when they are not smoking. So when you're using nicotine replacement, there's sort of advice in terms of dosing on how you explain to patients where to start, but actually the amount of nicotine they're going to need to use is about trying to get them to have as low level as possible of these withdrawal symptoms. So the numbers needed to treat for NRT to stop smoking is 15. So that means sort of between 10 and 20. For every 15 people who use the NRTs, only one will stop smoking. In some ways that doesn't sound great, but actually in the world of NRTs, that's not bad. But it does mean that there are many people that even with NRTs are actually not going to manage to stop smoking, which just reaffirms how difficult it is. And just to note that it actually does very little harm. So the numbers needed to harm for every 94 people that had it actually had to stop the nicotine replacement. And that's usually because of chest pains or palpitations. No one product is particularly better than any other, but we'll look at in which scenarios, which ones might work a little bit better. And just to note that the nicotine gets both excreted by the liver as well as the kidney. So in patients with kidney or liver failure, you're going to use lower dosages, and you might have to be a bit more careful in your very extreme liver failures and kidney failures. So these are some of the options. Probably in South Africa, one of the most feasible ones is the actual nicotine gum. You can get these from any pharmacy over the counter. And the way you're deciding on the dosing, so actually the dosing of the nicotine, the 4 milligrams dosing and the 2 milligrams cost the same. So that's not going to have an effect. So you're going to actually look at how many your patient is smoking to decide what strength of gum you're going to recommend, or you can base it on the time to the first cigarette of the day, which gives you an idea of that level of dependence. You can also use that dependence scale that we looked at. So if you're severely dependent, you're going to use your 4 milligrams, moderate and mild, you can perhaps get away with the 2 milligrams. So the idea is that you have about 1 or 2 pieces that you have every 1 or 2 hours. The idea is usually to target about 10 to 12 pieces a day. You never want to use more than 24 in a day. So, and usually people don't use at night. So it's usually during the day. As I say, most people can sleep through it, and you're going to taper it as is tolerable. And the idea is that normally one has like a 12 weeks stretch, and it's more for the patients get nervous about this possible withdrawal, but you might need less than that from the physical addiction point of view. So this gum, it also comes in flavors, but it's a little bit different than your normal gum. So you start chewing it, and when you chew, you get like a tingling feeling, or they say like a peppery taste, and then you just keep it in your mouth for about 30 minutes so it can absorb all of that nicotine. And obviously don't try and have coffee or carbonated drinks while you're having your gum. There are some side effects. Hiccups is one, a bit of jaw ache, stomach irritation, sore mouth, so mostly local effects. And the prices I've got off the internet, so I'm not entirely sure. This is Dis-Chem prices if you buy it from Dis-Chem online, so it's probably reasonable. But 12 pieces, if you're having your 12 pieces per day, that's about 70 Rand per day. So a packet of cigarettes, remember I said if you're smoking 20, that's about 30, 40 Rand a day. So it's a little bit more expensive than your cigarettes. So those costs are important to consider when you're chatting to your patient. The other one, which we've had only in South Africa for the last, is also more recent in South Africa, is the nicotine patches. But they also come in different strengths. You get 24 hours and you get 16-hour patches. I noticed the ones they don't actually say if it's 16 or 24 hours, the ones you get at Dis-Chem, but they're coming in 25, 10, 15 milligram patches. And again, there's a little bit of a dosing chart. I will send around to you, all of this information comes through the WHO Stop Smoking Guide. And they've got all very nice laid out, all these different things. You put it somewhere on the upper part of the body. And then after 4 weeks, you actually would start with you'll start with a recommended dose. And then for about 4 weeks, when you're now not smoking, then you'll only start tapering it by going down a strength. So if you start with a 14 milligram or a 21 milligram patch, then you're going to go down. If you start with a 21 milligram patch, you go down to a 14 milligram patch, and then 2 weeks later, you might go down for a 7 milligram patch. And again, it's going to take about 8 to 12 weeks that they're going to need this. So there might be some local skin irritation. Interestingly, some people have vivid dreams and sleep disturbances, because remember, this patch is most of the day. And 7 patches a discount costs about 280 Rand. So a patch is about 40 Rand per day. So that's actually a little bit more affordable than the gum. And from a packet of cigarettes point of view, but you have to outlay 280 Rand in a go. So there are other products. This is the Nicotine Nicorette Quick Mist. That's very relatively new. It's a spray that you spray into the mouth. So it also has quite quick absorption, which is why it's a bit more quickly absorbed than the gum even. And you take a couple of sprays every 30 minutes with no more than about 4 sprays per hour. So because it all gets absorbed through the mouth, so you don't breathe it in, it's got this very quick action. So you do start with that, and then after week 7, you're going to start reducing the number of sprays. But these are a little bit more expensive. So I worked out, if you're doing the 4 sprays for sort of the waking hours of the day, then you're going to end up paying about 100 Rand per day if you get that from Clicks. So that's about double the price of your cigarettes. What we don't have I haven't seen in South Africa is the nicotine microtab. So that's a sublingual tablet, also very quick to absorb, and the nicotine nasal spray. There's also non-nicotine-based products. Probably the most well-known one is bupropion, which is an old antidepressant, or Zyban. That actually directly affects the neurotransmitters and reduce the craving. So you use this very differently than you would nicotine replacement tablets. It comes as a 150 milligram sustained release tablet. And so the idea is you start on the tablet before you're going to stop smoking. So a week before, you take the 150 milligrams once a day for 3 days. Then you take the 150 milligrams twice a day for 4 days. Then after that week, then you stop smoking. So you have a quit date. And then you continue that 150 milligrams BD for 12 weeks. So it's seen as like a 12-week course. And then after 12 weeks, you just stop. And that's that. So there are some risks. There is a 1 in 1,000 risks of precipitating seizures. So that's the sort of in the box warning. And there's also a potential of increased suicidal thoughts. So these are things that need to be watched out for. So this is the costs. And again, I got this online, is about 383 Rand per month. So actually per day, that's quite cheap. But you obviously have to buy the whole month. Well, I don't know, maybe you can give a week at a time, but then you're paying your pharmacy dispensing costs. But because it's a 12-week course, it's actually going to cost 1,250 Rand for the 12 weeks. But remember, 12 weeks of smoking is going to cost you 3,000 Rand. So it's also a way of negotiating with your patient if you actually want to use something like the bupropion. And then the other one is varenicline or Champax. This actually blocks nicotine receptors, so it works on a very different pathway. Comes available in 0.5 milligram and 1 milligram tablets. And similar to the bupropion, you start the medication 1 week before you're going to go stop. So it's 0.5 milligrams for 3 days, 0.5 milligrams BD for 3 days, then you stop smoking. And then it's 1 milligram once a day for 11 weeks. Again, no need to taper. And it's got that same suicide risk. It's actually got a black box warning in the packet. This one I was struggling to get costs on from one newspaper article who was looking at the costs. They say it's about 550 Rand a month, again, for that 12 weeks. So a little bit more expensive than the bupropion. But this is definitely an option also for patients who have a little bit more money. And then actually still on paper, you're still going to spend less money on this if you're a 20 packet a day, 20 days, 20 cigarettes a day smoker. So there are clever ways in which you can combine these, but of course that puts up the cost. So the American Council for Clinical Pharmacists, they actually recommend, and there's some nice evidence for that as well, that you can use the patch as a controller, and then you use the gum or the spray as a reliever, a bit like we do with asthma. So you put your patch in every day to overall reduce your craving, but if during the day you suddenly do crave and you get a bit panicky, then you use the gum or you use the spray as a quick relief of your symptoms. So that's quite a nice option, but it's going to be a little bit more expensive in terms of what people have to outlay. There's actually also quite good evidence for combining NRT with bupropion with an odds ratio of 2.57. But you would never combine varenicline and NRT. It just doesn't make sense because varenicline actually blocks nicotine receptors. So to then give nicotine would be a bit silly, although there's not much evidence on that. So the big question, and this is actually a big debate, is what about e-cigarettes as a way for using it as a nicotine replacement methodology? So this is very controversial. And if you go online, there are huge debate within the medical